with that, let me start with my brief introduction. What we're going to do now, and I'm going to just give this a brief introduction. So as you heard, the title for this webinar, hopefully you already read it, was How Can a Program Design Financial Support to Households to Reach the Most Disadvantaged? That actually wasn't the first title that we came up with for this webinar. Originally, it was How Can a Program Design Sanitation Subsidies to Reach the Poorest? But in working with all of our partners in order to create this webinar, we already realized just from those discussions, we learned a lot about how we can even talk about these terms. And so Andy's going to tell us about a recent workshop, and we'll talk about some of these terms, why we changed it, the name, from subsidies and just saying financial support. Andy giving me a look, he might not exactly talk about that. But based on this workshop, the name was kind of changed based on some of the learning. So Andy, no pressure. So I thought I'd start with a slide from Jan Williams' presentation from the last webinar SuSanA and the Beam hosted. As Jan Williams said, as a sector, we've come together around 3 building blocks. These might look familiar to many of you: the Indonesian government, the London School of Stools, and even I work at the World Bank, and we have adapted these 3 elements. We call them the 4 building blocks, and we've added learning as a 4th building block. So while we agree, I think, on many of the big structures, enabling environments, and the need for creating demand and ensuring supply, one of the things that many of us have struggled with is how do we make sure we are reaching the most disadvantaged? At the same time, we all want to make sure that efforts to reach the most disadvantaged do not disturb other efforts in countries to, 1, support the real private sector to grow and grow really household individual purchase, and 2, we really don't want to damage that triggering and real lasting changes in social norms. So today, we're going to have a couple speakers talk about what they're doing to try to reach the poorest or those who are hardest to reach. So we've got a lot of speakers. So each of them was only given 5 minutes, and while they're speaking, you're going to have this little box here where you can type your questions and answers for the speaker, and know that they're really just going to give you big picture top line. So later you can ask them more questions, and actually even after the presentation, just like some of us joined a half an hour early, we're going to stay for a whole half an hour afterwards so that you can still continue to ask more questions. So as we are changing speakers, we might have technical difficulties. We've got a lot going on technically here. So if we do, and if you're at a laptop, please take the chance to always just answer these poll questions that are there, or type and talk to other people. So with that, I am now going to move to Andy. We're going to unmute him, and we're going to let him give his presentation a brief overview. So with that,
great.
Andy, take it away.
Thank you, Emily. I wanted to start by drawing our attention to the Sustainable Development Goals and saying, we now all have to aim and think about eliminating open defecation and think about equitable sanitation for all. So this requires that we go back and look at our approaches, look at the outcomes we're achieving with a slightly different lens. So one of the questions we're asking is, do we actually need more support and finance? Approaches like CLTS and some other approaches with collective outcome aims are already designed to reach everyone. Some people would question whether this is necessary. However, we have evidence from sustainability monitoring and research evaluation, which I'll talk about in the next slide, and which shows that not everyone's being reached. And when we look at who's losing out, we find it's quite often the most disadvantaged. This very colorful slide is presenting the findings of final evaluation of an 8-country program in Africa. I don't want you to get too tied up in the detail, but what I was hoping to take out of this is that each of the columns is a country. The 3 columns on the left, we found very high toilet coverage. So this is 1 to 5 years after ODF verification, and 92% to 96% of all the households surveyed in ODF communities were using toilets. But even within those groups, if you look at the blue color, that's where there was 100% latrine use. And we found that even in those really good country projects, only 50 to 80% of the villages actually had 100% use. So in at least 20 to 50% of all the villages, some people are not using toilets. And when we look at who those people are, quite often we find they are the most disadvantaged, who tend to have the highest disease burden, so are groups that are very important. Why are they not being reached? There's lots of different reasons. They're not building durable enough facilities, they're excluded or marginalized from processes. Sometimes there's coercion from local governments and leadership that want to achieve collective outcomes. Sometimes there's low quality verification of ODF, so they were actually never ODF in the first place. And sometimes it's a sustainability issue, there's not enough following, monitoring, that wasn't thought about in the design. What do we do about it? A couple of solutions that are getting traction that we're using a lot now. One is thinking about longer term support, having multiple phases, building on post-ODF interventions. And the other is looking at targeted finance. How do we really make sure that those people, the most disadvantaged, get the support they need? I want to briefly talk about a few of the key principles. So we're trying to avoid the pitfalls of sort of conventional upfront subsidies. So one is to try and reward good sanitation practice, to say we don't just give subsidies to those who don't have toilets. We try and actually look at the most disadvantaged, reward them when they have good practice, reward communities that have good practice. Another one is looking at the demand side, so providing choice of what sort of facility you have, choice of supplier, and this means looking at toilet vouchers, rebates, conditional grants, conditional transfers, financial mechanisms that allow that choice. I'll skip on quickly. Why do all this? What are the benefits? What we're finding from some of the initial work is this actually creates incentives for ODF, so that where people can see that they will receive further support after ODF, this encourages them to put in the effort, the behavior change to achieve ODF. We also want to avoid undermining CLTS, sanitation marketing, a lot of the other interventions going on, and strengthen local markets. So this gives us opportunities, ways of doing that. And finally, we're sort of very much focusing on outcomes and saying we can have a range of approaches, a range of incentive mechanisms, as long as we agree on the outcomes we want to reach. A lot of other lessons and examples I included on the slide, but I won't go into those because we're short on time. So I'll stop there.
Yeah, great. Thank you, Andy. I really appreciate that. That was a great introduction to some of the big issues behind subsidies and giving households financing. So like I said, we're going to collect all the questions, and then at the end, we'll give them to each of the speakers. So what we're going to do right now is move into hearing an example from Tara Hill, who is speaking to us today from Cambodia.
So thank you for the invitation to join this webinar. I'm presenting on behalf of the East Meets West Foundation, which is an international NGO operating in Vietnam, Cambodia, and Laos, where among other things we focus on innovative approaches to rural sanitation, water, and hygiene. So today I'm just going to give a quick high-level overview of one of our flagship approaches, which is the use of output-based aid, smart subsidies, to increase access to rural sanitation for the poor. So most of you are probably familiar with the basics of an output-based aid approach. So just to give a quick introduction here, unlike traditional input-based financing, output-based aid, the key distinction here is that payment is made after the verification of specific outcomes that have been predefined among all actors in the project. And East Meets West pioneered this approach in rural sanitation under a project called the Community Hygiene Output-Based Aid Program, also known as CHOBA, between the years of 2012 and 2016. And under this approach, what we were trying to do was identify a mechanism that could effectively and transparently reach the bottom 40% of households' income with improved sanitation facilities. So why did we choose output-based aid? Well, because we felt that existing approaches, as Andy mentioned, weren't effectively or quickly reaching the poor. And so we wanted to test OBA as a mechanism for doing that. And we also wanted to see if OBA could be a viable approach to implement at scale. So under this program, poor households received a small cash rebate for the installation of hygienic latrines. And implementing partners also received small performance-based incentives for their role in the program. Critically, all of these payments were made after verified results were achieved, so they were not provided upfront, as the principal mentioned by Andy in his previous remarks as well. So on the next slide, you can see some of the results that were achieved in Vietnam. This program was implemented in Vietnam and Cambodia. Across both countries, throughout the course of the 4-year program, the use of the OBA mechanism resulted in close to 170,000 latrines being built by the bottom 40% of poor households. And at the peak of this program, it was resulting in about 5,000 to 6,000 hygienic latrines being built by poor and near poor households across both countries. In terms of lessons learned from this program, there are so many, so I won't attempt to go into all of them in detail now. But just to give a flavor, I think what we found works well with output-based aid is the need to be very clear about the objectives of this approach, which for us is to target the bottom 40% of disadvantaged households. The design of the results-based financing tool should be very much designed to fit with the local context. And so this can influence both the implementing partners that you're working with, the type of incentive that's provided, whom the incentive is provided to, and perhaps most critically, the establishment of a robust monitoring and verification system that's flexible and independent was hugely important to the success of this approach. What doesn't tend to work well is having a low tolerance for risk, a lack of transparency, or a rigidity on the part of donors. We found that this approach was quite cost effective. So as you can see on this slide, for every $1 of donor finance invested in the program, CHOBA resulted in a $9.5 investment by households, which is significant again because this was investment made by the bottom 40% of households. And finally, just to touch on some research that was conducted, particularly with regards to the program here in Cambodia. We collaborated with the WSP on a piece of research that sought to understand what is the role of output-based aid subsidies in relation to more traditional approaches like sanitation marketing. And the question we were trying to answer was, do OBA smart subsidies interfere with or complement sanitation marketing approaches? And what we found through this research was that when you looked at non-poor households, unsurprisingly, the sanitation marketing approach as a standalone intervention was more effective at driving latrine coverage. But when you looked across households of all income levels, including poor and non-poor, we found that actually the combined interventions of OBA and the sanitation marketing was the most effective way to increase latrine coverage. And so what this suggests is that the two interventions should be seen as complementary. They have positive additive effects, but that when you isolate the household alone, in this case we found that the OBA subsidy and the targeted finance was the most effective approach at driving latrine access and promotion. So I'll stop there. There's a lot more detail I could go into, but hopefully we can get into some of that in this discussion.
Great. Thank you so much for sharing that, Tara. That is great. So we're going to now move into an example and hear from India. And Arun is going to give us a presentation sharing what's been happening there. So with that, Arun, go ahead and take it away.
Yeah, hi everyone. This is Arun from the World Bank India. I'll be sharing the innovative approach of compressed demand for sanitation, which has been tested out in the state of Uttar Pradesh. So I'll be sharing that example. So Uttar Pradesh, as you would be knowing, is the most populated state of India with around 200 million population, and the present rural sanitation coverage is around 48%. We have got more than 15 million toilets, household toilets still to be constructed to make rural Uttar Pradesh open defecation free. The new government of Uttar Pradesh has got very ambitious plans to make the state open defecation free by October 2018. While the state government has adopted community-led total sanitation approach as the key approach for addressing sanitation behaviors in the district of the state, yet the target is quite ambitious. So if you look into the national flagship program, which is called the Swachh Bharat Mission Gramin, it has a provision of INR 12,000 as subsidy for individual household toilets. The baseline survey of 2012 of the rural households across the country, including the state, it is the guiding survey for identification of the target households and estimating and establishing the subsidies for the individual households for a district. As with all the surveys, the baseline survey is also inclusive of so many determinants which have been which occur at the during taking the survey, and so all the political interference at the village level is there. So it is not it is all the surveys where it has all its ramifications. Also, the fund flow and the availability of the funds for the toilet subsidies, this is a great cause of concern, and we are increasingly seeing that fund availability is quite less. So I'm just going to share an example of what a district, Bijnor, in the state of Uttar Pradesh started off to see how alternative demand can be created, keeping in view the eligibility of the households for the subsidies and the availability of the household funds. So like when we talk in terms of that the CLTS training is given to the village motivators, which is followed by a triggering of the rural communities on sanitation and behavior change. So when the triggering teams carry out the household surveys in the village, it was found that there were many households who did not have toilets, yet they were not included in the baseline survey. Yet there were also many households while having no toilets, and they were in the list, but they had the financial wherewithal for toilet construction. So one of the highlights of the Swachh Bharat Mission Gramin program is the flexibility which has been provided to the districts to utilize the subsidies available at their disposal. So using this flexibility, the district magistrate of Bijnor tested an innovative strategy to ensure that the genuine needy households eligible for government subsidies are covered in the program. So a criteria was developed while working with the communities and engaging the community in the entire process for selection of these households. This was mainly to give priority to the very poor, widows, handicapped, and people with temporary houses. So economically well-off households having immovable and movable assets like having a tractor, having a two-storied house, having an adequate agricultural land, they were taken off the eligible list. So the original household sanitation demand of the village, it gets compressed by the number of these economically well-off households who make the toilets on their own. However, all these households, including the economically well-off households, they are included in the design of the IEC program, the overall motivation and awareness programs in the village. So the role of the government becomes that of facilitator, while the triggering teams and the Nigrani committees, also the surveillance committees who made these revised list of households, which are ultimately approved by the village panchayat in a community-wide meeting and then by the district sanitation committee. So this process enables us that within the limited funds available at the disposal of a district, the compressed sanitation demand is able to identify the real and the needy households and provide subsidy to the real needy people. So this slide is one of the households which have constructed from their own. So if you look into the key learnings which have come up, the compressed household toilet demand is with the community concessions. It has been identified as a very innovative approach for identification of the needy beneficiaries, streamlining of the Swachh Bharat Mission targets, and optimization of the available rural subsidies. The only thing is the constant community engagement is the key to the entire success of the program. And the regular monitoring by the surveillance committee on the construction and usage is integral. In the district region I'm talking about, in the entire process, it had about 0.125 million households. By adopting this entire compressed sanitation demand approach, the demand was reduced by 0.1 million households, and there was a consequent reduction of subsidies of about $20 million US. Taking this approach, many other districts have come forward in the state to implement this innovative approach. And there have been many cases where the districts are taking up, and the state is seriously thinking on how to really make it as a part of the policy design. So that's it from my side.
Great, thank you so much. That was really informative. Thank you so much. So I've changed the screen once again, and there are some new polls up here, and there's still ability for to type more questions over there, but I hope everyone will go ahead and start answering those questions down there if you'd like. Now my other question, if you have questions for the speakers, what I'd like you to do is either type it in that box and Sarah will share it with the speakers, but we're also going to invite you to raise your hand. So in the middle top of your screen, there's someone with their hand raised like this. And if you click on that button, you should be able to raise your hand, and that'll move you to the top of my screen so that I know that you have a question that you would like to ask. For any of our speakers, any of the speakers. Now, while people are thinking of their questions, we're going to have one more speaker from Bangladesh. And Ahmed Mubarak, or Mushfiq as most people know him, was going to share the results of their study that has basically shown that giving subsidies to some households did not have any impact on the rest of the household. So the rest of the household still bought sanitation and at the same rate or even a greater rate than those houses who were receiving subsidies. So there was no adverse effect of having had subsidies if those subsidies were targeted for the poorest. So with that, let's see, I'm going to let Sarah speak. Oh, no, Durba has raised a hand. So go ahead, Durba. Sarah.
I think there's a question from Durba here about the idea of building adequate toilets is essentially a basket of characteristics, including good disposal systems. How would that be addressed?
So who wants to take that? Is that a specific India question, or would any of you like to address that? Go ahead, our panel, speak up. And Andy, go ahead and put back on your video so you can look like you're part of a panel here.
On the issue of impacting on surface and groundwater, I mean, it's a little bit apart from our topic and a bit technical, but yeah, I mean, I think it is an issue, and it is something we're looking at. One of the things we've been doing is in this phased approach is saying, okay, first we want to stop open defecation, we want people to build toilets, then we look at upgrading them, trying to make them more durable, trying to make sure we're reaching everyone, and then we're really targeting the wastewater protection, water supply protection, solid waste disposal, the broader elements of environmental sanitation. It's a bit of a woolly answer, but I'll stop there.
Now you can let us know if you felt that answered your question, or you can just keep typing, or you can speak. I don't see anybody else raising their hand, so I'm going to let Sarah then summarize any other questions she's read in the chat box, because I can't quite keep up.
Okay, we can go back to maybe one of the first questions here that was raised, which is the types of costs that might not be considered by program designers, and maybe some of the speakers can touch on those types of costs within their different projects.
Okay, I'm going to ask Arun then. Arun, can you comment on that? Mm-hmm.
Yeah, actually, if you look into the context of in the setting of India, the average latrine cost for a twin pit 4-flush toilet is around 12,000 Indian rupees, which the government of India is also providing the rural subsidies at this present. So the progress which we have seen and the experience which is coming across different states, that if we follow the specifications of a 1 meter deep pit along with the standard 3 by 4 feet the superstructure, and with the use of the local materials, it is you can really make a toilet within this the provisions of 12,000. However, if we try to go for other advanced technologies like the septic tank, then the cost increases. And for areas like where you have high water table areas, where you go for ecological sanitation toilets, the cost also increases. But for in the general Indian setting, the cost is what the government is providing, it is manageable within those costs.
Okay. Andy, I think you also typed a little bit of a response to that question. Do you want to share your thoughts too?
Yeah, well, as Martin Gambrill noted, there was a UNC paper that was recently released entitled The True Costs of Participatory Sanitation, which examined some action research projects through the Bill and Melinda Gates Foundation and Plan International. And it specifically identified some of the costs of participatory sanitation, specifically CLTS, that are not usually counted. So local government involvement and involvement of various local actors, community participation in all of the participatory activities and community monitoring that takes place, actually the construction of toilets, and even when people don't purchase things from the market, they use their own materials, their own labor, their own time. So this UNC study looked at trying to cost all those hard to value elements to see how better we can compare the costs and benefits of different approaches. Part of the work that's following on from that is then saying, okay, we don't do enough to think about sustainability and to look at the costs in our design and budget for all the post-ODF and sustainability activities that are required to really sustain the outcomes we're looking for.
Great. I see that Tara has now, Tara is unmuted, and I see that she was raising her hand. So Tara, did you also want to chime in on the answer to that one or one of the other ones?
Sure, yeah. Sorry I didn't jump in before, but just to add to that, I think that was one of the questions that we were trying to answer through this piloting of the output-based data approach, was that through an output-based approach, the idea is that you know exactly what the costs are because you're paying for a specific outcome with a specific cost. So in our case, the output-based payments were flowing all the way through the program structure, from the donor to us as the overarching implementing organization, and then from us down to our implementing partners and the household and so on. So for a set price, in this case of this project, $50 per latrine, that included all of the associated costs to achieve that one latrine output, hygienic latrine for a poor household. So that's one of the theoretical and practical advantages of using an output-based data approach related to that question about cost.
I wonder if someone, Jamie or Michael, who attended the workshop, wants to chime in and also speak up. So I won't force you to, but go ahead and raise your hand, and then we can let you speak a little bit about some of those things. Sarah, were there other questions?
I think there's a question about reward mechanisms, and I can't see here exactly, but what kind of rewards or criteria were used? I think this was a question for Andy. What kind of disadvantages are there for households? I'm not exactly clear on that, so if the person who asked that question, you can put more detail in the chat window. That was Heng, I think.
Shall I
go ahead and comment on it.
A first attempt, and hopefully other people can add something. I mean, what I was talking about specifically was there's been efforts to reward communities that achieve ODF outcomes, to say, okay, if the community becomes ODF, you can either receive a collective reward. I mean, there's cases in India where that's happened, and there's been lots of problems and issues with the Nirmal Gram Puraskar and some previous reward systems, incentive systems. However, there's also been some good progress, and there's also targeted subsidies that have been given post-ODF to specific groups within communities, toilet vouchers that have been given. The East meets West Thrive model has used toilet rebates. So if you're a poor household and you build a toilet that meets their hygienic toilet criteria, then you get a financial payment when it's verified that you have built that toilet. So there's many different forms, and I wasn't trying to sort of point to any in particular, but to say a lot of these work in different contexts and can be used to reach different segments of the population. So I think we need a mix of these solutions to be used. Thank you.
Tara,
Emily,
do you
can I
want
come
to
in?
share some of the benefits? Oh, go ahead, Arun. Yeah, and then Tara.
Just to what Andy just said regarding the Indian context, the debate which is going on in India as of now is we are having a lot of districts which have self-declared ODF. So now the process of the verification of the ODF is on. So what we are looking at, how to bridge this gap between declaration and verification. And different states are coming up with different models of awards and reward system. So once a district or a block or a village becomes really verified and in terms of ODF, and that sustainability is carried over a period of 6 months to 1 year. So that is the debate and the intervention which is going on in India across states right now. Just wanted to flag this issue.
Tara, do you want to share what your result, what you used? And
Sure, yes. So it was a combination of the different approaches that Andy just outlined. In the CHOBA program, there were two sort of criteria used. One was at the household level, and then one was also at the commune or the community level. So at the household level, households had to be verified as meeting a poverty criteria in order to be eligible for the household rebate. So in Cambodia, we used the ID poor system, and in Vietnam, we used a similar government classification system. And then the households had to be verified that the hygienic latrine had been installed. So it wasn't just the provision of materials, but it actually had to be verified that the latrine had been properly installed. And we also would look at usage of the latrine post-installation. So what the criteria allows us to do also is to look at elements of behavior change and usage as well. So for example, in Cambodia, when we first started the program, we were just verifying upon installation of the latrine, and that included simply the substructure. When we did the verification, we found that actually usage rates were not as high as we had hoped, because in many cases the substructure had been built but without some form of shelter households might use them. So we then adjusted the verification criteria to include the fact that a shelter had to be constructed with the substructure, even if it was just a very simple structure, in order to encourage usage. So that was at the household level. Under CHOBA, we also had community-wide incentives where we were offering a CCT to local authorities based on whether there was a 30% increase in sanitation coverage among poor households. We did some research in Vietnam that ultimately found that the household incentive was more effective at promoting uptake than the community-wide incentive. So in subsequent iterations of the program, we've really focused more on the household incentive than on the community-wide.
Great. Thank you all for sharing those results. Also, in this section, please scroll through over here where I said please type your questions, because there are some great answers coming from some of the participants as well. Jamie just typed and said that he can share a few, speak for a few minutes about kind of the workshop and some of the key line results related to this. So go ahead, Jamie. Okay, well, with Sarah, were there any other questions while Jamie's trying to?
Someone had a question about how reuse or dry toilets, if that is applicable to any of these experiences.
Anyone want to chime in? It seems a little different. The technology options, I think so many of what people have presented, basically any technology option that a consumer wanted, they could use. I'm imagining that there was no restrictions, but that it's about what's aspirational for the user, and if that's what they choose, then that's an option. But do any of you have different results that you wanted to share on that?
One principle, if you look at the sort of social protection literature, is that you should, if you're going to provide a subsidy of some sort, financial support of some sort, that you should subsidize the lowest acceptable level of service. Where possible, you don't provide financial support for higher levels of service, which then create problems of targeting and exclusion and inclusion errors. So quite often a dry pit latrine is the simplest solution and is something that is supported and encouraged in many parts of the world.
We have another question here. Can we hear some views on how we ensure sustainable ODF?
Tara, were you just raising your hand wanting to speak? I'm sure Jamie would love to speak on this.
I was just going to add on to the previous question. In our case in Cambodia and Vietnam, you're right, it depended on the preference of the customer or of the household. So in Cambodia, we found that the majority of households opted for the easy latrine model, but in Vietnam, the cultural context was quite different, and most households were opting for septic tank latrine. So for us, I mean, the level of subsidy stayed the same, and then it was up to the household to decide how much additional finance they wanted to seek out through loans or otherwise to finance the option that they were interested in.
So then going to the second question Sarah asked on sustainability, anyone want to comment on that of open defecation free? I see lots of people typing about that now. Great. Jamie, go ahead.
Hi. Sorry for I'm not so good with the technical stuff. So I'll give a brief overview of an event which UNICEF and the CLTS Knowledge Hub hosted last month in the Philippines. It was a Asia regional forum, and we were looking at ways in which the poorest can be supported throughout the CLTS process. So the types of things we discussed included like the types of support that can be given. So we've discussed both facilitating and strengthening intra-community support, as well as providing support from outside. And then around those, we looked at some issues and concerns, questions surrounding sequencing, some emerging principles, and some action points. And yesterday we released a 4-pager, which I put into the questions box earlier, but I'd be happy to share again now. And we're very keen to hear people's feedback, and it was a way to really start the conversation and get more people involved.
Great. Do you have any comments on the sustainability question? How do you, I think that was part of the things that you looked at the conference was ODF and beyond, and so how do you sustain ODF? I think that was the question Sarah was asking, again, that had been asked.
Sorry, I missed the question.
So I don't want to misphrase it. Sarah, do you want to say it again?
Yeah, this was a question from the World Bank office in DC. Can we hear some views on how we ensure sustainable ODF?
Well, we did discuss this mainly because some of the sustainability studies is showing that it's often the poorest and most vulnerable who struggle the most with maintaining hygienic toilets and continuing to use them. So the discussion was really a way to try and tackle that. And there's still we don't really have the information whether support should come in on the way to ODF or once communities are ODF, and I know there's lots of people with lots of different opinions on that, but I'm not sure we're really there yet, and it's going to be very based on context, I suppose.
Okay, who would like to chime in on that one? Andy, do you want to respond, or can I get anyone from USAID or UNICEF to chime in on this very tough question as well? Go ahead, Andy.
Yeah, it'd be good to hear from someone else. I've been doing too much talking.
Oh, Michael raised his hand, so go ahead, Michael. Take it away. Michael from UNICEF.
Hi. Yeah. Well, one of the things that we're seeing definitely as part of ensuring that you have ODF sustainability is post-ODF monitoring. That's one of the kind of key areas. The sustainability checks in many of the countries are helping improve maintaining these ODF outcomes by continually going back to these communities and ensuring that there's ways to make sure that social norms that are created are maintained and that habit formation starts to happen. The challenge then is how do you make sure that the places that it also helps with making sure that the places that have been previously declared ODF that might not necessarily be ODF gets rechecked to make sure that that ODF status is actually achieved and maintained. In like was being shared by Andy and Louise in the Philippines is one of the examples where we used a phased approach where higher levels of ODF becomes part of the process. So aside from just post-ODF monitoring, there are actually higher level targets, which isn't too different from what, for example, in Indonesia where they have STBM, except there's clear indicators for the second phase and third phase of the process. We can probably share a little bit more details through a couple of papers that we wrote.
Great. So I think some people were mentioning that they're having trouble hearing Michael, but he did mention that there's a couple papers on this, and so maybe he can post them in there about how they were doing a phased approach. So with that, I know there's lots of questions and the excitement is still going on, and so don't worry, don't go away. But what I do want to do is make sure that we end on time. So what we're going to do is move, I've just changed and put new poll questions up, and I'm going to give a chance to Pom, who is going to be speaking from the government of Cambodia, to give a few of his parting thoughts. Now, after that, I'm actually going to show you one more screen, and then we are actually going to stay here online, and we can have like anyone who wants can leave, but we'll stay for about 30 minutes more, or as long as everyone wants to stay for that full 30 minutes. So let's give a moment to Pom to try to give us some concluding remarks, really from the government's point of view. So Pom. So I put up new polls. So while Pom is trying to put on his microphone, go ahead and answer these questions here. So my middle question here was just kind of wondering what countries did we miss out on? I really wanted to present a country from Africa and not just have Asia examples, but I didn't get any volunteers. So if I missed some countries, please write the examples, example country there. Pom, yeah, I can hear you, Pom. Thank you.
Actually, I've learned a lot from these discussions, and I think we've gone through a long process for subsidy, non-subsidy transitions, and of course that what we have learned so far is that subsidy is not the way, and of course non-subsidy alone, for example, if you're just talking about CLTS alone, is also not the solution. So what we have learned from several cases is here is like we need to find a kind of a good solution, a context-based solution. And for us in our country, we are transforming from the subsidy to the non-subsidy approach. But now it is a time that we realize that more holistic thinking need to be considered. So the most important that we have learned from our case is that we need to have a ground rule, which we, for us, we call it guiding principle. What we mean is that we will not provide a subsidy unless it is necessary. So again, if we are talking about this necessary, then we need to have a good understanding from all relevant stakeholders. That's why we develop our own guiding principle. And I'm not quite sure other countries have a similar experience as we have done, but for us it's very useful to have this kind of ground rule so that we can introduce this guiding principle in the kind of consensus way. What we are trying to put into those guiding principles is that we have to identify clearly what is the definition of providing subsidy, and what are the principles that we need to agree on, who is eligible, and then we also need to identify what needs to be subsidized, and then how much, and so on. So again, from what we have shared, what we have discussed so far, it's really give us more idea, more insight. Because what we have developed, this guiding principle, is not really a prescriptive approach or tools, but it gives flexibility to all relevant stakeholders to provide, to do their own kind of support to those who are in need. But what we have learned is that this guiding principle is provide us a ground rule so that there is no conflicting.
Great.
And
Thank you much.
so far we have some of harmonizing our approach and our support to the poor.
Yeah, no, thank you, Paul, for those great concluding remarks. I think your experience is similar to many. I do want to comment just quickly on this poll here that I can see that those countries that are voting no, that still feel like there really should not be any financial support, actually are some of the poorest countries. Those people who are writing over there, no financial support should be given, are actually some of the poorest countries. So, Pom, I don't know if you want to say anything about that. Do you have any ideas or what you feel like maybe makes Cambodia different, and that now you're at this phase where you can identify those ID poor people?
I think in principle, we need to support the poor. That is a consensus that we have learned, because in our strategy, the latest strategy, we mentioned that subsidies the last resort. And of course, the last resort here refer to those who are poor, for those who are disabled, and for those who cannot afford. So the most important part that we need to make sure is that we all agree that to support those, we need to have a ground rule, as I share with you. And I think we can share with you those kind of guiding principles that we have developed and we agree. And now we are trying in the process of disseminating those guiding principles. That is the most important part. And of course, the output-based approach is, that is one good example that we can do, and it is well aligned with the those guiding principles. So for us, I think we need to have to find a way to support the poor, because of course the demand creation alone, like COTS, is not the single bullet to solve the sanitation issue. And of course the sanitation marketing alone also not the way. So the way forward, which we have agreed in principle, is that more holistic thinking and context-based. We cannot find one single approach to solve the whole issue. So contextualize is needed, and we have to have a good balance in terms of finding a good program to solve the issue of particular areas.
Great. Thank you so much. That was a great wrap-up. With that, I'm going to move one more time. For those who came late, here are our speakers. If you'd like to get in touch with them all, here is their full names. Arno and the team from SuSanA, including Sarah, will actually be posting this slides online in a video format. Also, I guess I just wanted to say one more time, if you missed at the beginning, that there are some things we disagree on, but there are kind of these three elements that really seem to have, or that we agree on as a group, that we need to work on: supply, demand, and enabling environment. With that, I'm going to pop up a final slide here where you can answer lots of questions. There's lots more. If you'd like more information, here's some resources. Tell me some other resources that we missed, though it seems like lots of people included those in the questions already. If you'd like to join more rural sanitation webinars, go ahead and sign up with the link there. You should be able to just double click that link. And then tell us what you thought. Lastly, tell us what you thought of this webinar. Did you learn something that you can use? Do you have edits to the format? Do you totally disagree with the topic we discussed? Please go ahead and put your comments there. So with that, I'm going to let those who want to leave. But like I said before, we are going to stay here for another half an hour if people want to stay and continue talking about these topics. So raise your hand if you want to speak, or they're just going to open up the mic so you can go ahead and speak. So thank you all for joining, and thank you so much to our speakers.